Very good afternoon, students. Yesterday we learned about the external features of the heart. Okay. Today we are going to learn about the various chambers: right atrial cavity, the left atrial cavity, then the cavities of the right and the left ventricles. Okay. Now just here we will first learn about the chamber of the right atrium. Okay. Now from the costal surface, okay, sternocostal surface, this is the sternocostal surface, and this structure is the right atrium, okay, present just below the ascending aorta, which is forming the arch of the aorta. This is the opening of the superior vena cava here, and this is the opening of the where my finger is going, is the opening of the inferior vena cava in the right atrium, which brings the venous blood. They are extant as sulcus here, called as the sulcus terminalis, from that of the superior to the inferior vena cava. Thus the right atrium on its external surface forms the sternocostal surface, as well as on the posterior surface it also, or the base, it forms the base or the posterior surface partly between the opening of the superior and the inferior. This is the opening of the inferior vena cava, and this is the superior vena cava. This tube which is attached here is the superior vena cava is here. Okay. Now I have, for exposure of the right atrium, I have given an incision just close to the sulcus terminalis, and then also I have given a cut at the junction of the atrium and ventricle, and through this triangular flap I have just reflected upward, okay, reflected upward. Now this is almost a normal heart, but I have dissected a enlarged heart, okay. Just to show you the chambers of the heart, I have used a very enlarged heart with the cardiomegaly, because if you dissect a normal heart of the normal size, okay, about which is about 300 grams, then especially in the left ventricle cavity you are not able to see anything, because due to the fixation of the formalin, the walls which are very thick, they become very thick, and hardly any cavity is there from where we can actually see the relations of the mitral wall and the relation of the tricuspid aortic wall, semilunar aortic wall. Okay. So that's why I have chosen a heart which is very large, abnormal heart. Okay, you can say that is abnormal heart. Okay, where I have shown you the cavities. This is, see that how big is this heart, and this is purposefully I have chosen this heart to show you the cavity. I will just orient you. This is the ascending aorta, the arch of aorta. This is the large thick pulmonary trunk, which is dividing into the right and the left pulmonary veins. Okay, this is the left pulmonary left pulmonary artery and the right pulmonary artery. So this is the pulmonary trunk. Okay, this is the arch of aorta. One of the abnormality which you can see is in the vessels arising from the arch of aorta. This is the brachiocephalic trunk. Okay, then this must be the right, okay, common carotid artery, and this is the left common carotid. But in between that there is one extra artery is present here, taking origin from the arch of the aorta. This may be the thyroid imma artery, which goes to the thyroid occasionally, but it seems to be having a large caliber or diameter, so probably it must be the left vertebral artery, taking direct origin from the arch of the aorta. Okay, so this is the first abnormality. Now we go to the right atrium. See, if I keep it in anatomical position, this heart will look like this. Okay, this is the sternocostal surface, which is quite large. Okay, this is the right atrium, where this is the superior vena cava is opening. See this superior vena cava opening into the right atrium, and this is a large orifice here, abnormally large orifice, which is for that of the inferior vena cava. So this is the superior vena cava here, and this is the superior vena cava and inferior. So this is the sulcus terminalis, and just on to the right of the sulcus terminalis I have incised this, and then I have given an incision at its junction with the right ventricle here, and then I will reflect this triangular flap of the anterior wall upward like that. So let us see this posterior aspect of this anterior wall, which is quite rough, and this is that sulcus terminalis was here, and when you reflect it, you will get a vertical ridge. And can you see this vertical ridge? And this vertical ridge is called as the crista terminalis. And from the crista terminalis, many horizontal muscular ridges, they will run horizontally, and they will all try to concentrate towards the orifice that is called as the atrioventricular orifice. So this orifice is atrio. So in this wall, this will try to, this musculi pectini, or pectinity, this is called as musculi pectinity, and this musculi pectini or pectinity, they come and just end near the atrioventricular orifice. From where they are arising? They are arising from the crista terminalis, and these are muscular ridge. These are mainly derived, I would say, this portion, the rough portion of the anterior wall of the right atrium is derived from that of the primitive, I would say the original heart tube. While then there is a posterior wall also in the right chamber, which is smooth, which is smooth, and you don't see in this wall any of these muscular ridges. Now I will tell you the openings into the various openings which are seen into the posterior wall. I mean say into the smooth part. Let me just hold this rough part and reflect it so that you can see the posterior wall. Now if I put my finger here, or let me put the forceps here into the opening of the superior vena cava. See this? This is the opening of the superior vena cava, which has no wall. It is all smooth here. See this? This is all smooth is here, and there is nothing seen here which is rough. So this is the smooth opening of superior vena cava, and I said that there is an abnormally large opening of the inferior vena. See this, where my handle of forceps is there. This is the opening of the inferior vena cava is there. Then there is another opening which is seen, is that of the opening of this ball, that is tricuspid, right atrioventricular wall, I mean say orifice, right atrioventricular orifice. You are seeing the right atrioventricular orifice from the top, and these are the cusp. So there will be three cusps. That's why it is called as a tricuspid. It is called as the tricuspid. If I put my finger from the ventricle side, then you can see that cusp, which I am just lifting here with my tip of the finger. This is the anterior cusp, of the atrioventricular orifice. And then if I put my finger deep inside, to that of the septal cusp. I will just lift this to show you. This is where I am putting my finger deep to the septal cusp. Just let me show you. This cusp here. It is coming from septum side. So this is the septal cusp is here. So this is the second cusp. And third cusp which you will see here is that of the posterior cusp. See this? I will just put my finger deep to this cusp to lift it. So this cusp is the posterior cusp. This is the posterior cusp. So there are three cusps: an anterior cusp in the orifice, and the posterior cusp, and one is the septal cusp. Okay, it is in the whole heart. I have just hold it into the anatomical position. So according to the presence of this cusp, you can make out anterior, posterior, and the septal cusp. So this is anterior, this is posterior, and here is the where my fingertip is there, septal cusp, which is quite small in this case. Okay, so this is another opening called as the atrioventricular orifice. Okay, orifice is here. Now one more opening I will show you, and this is just between the opening of the inferior vena cava and that of the orifice. Okay, this atrioventricular orifice, and that is the opening of the coronary sinus. So let me expose the coronary sinus, and then I will show you. If you can see, okay, just let me put the light inside it. Okay, it's not seen. So I will put the tip of my forceps, okay, into the opening of the coronary sinus. Okay, here here can you see the tip of the forceps? Okay, it is difficult to see because I don't want to cut this appendages, okay, or entry wall of this. So this is the coronary sinus opening, which is guarded here by the semilunar wall, okay, a semilunar wall of the coronary sinus. This, I think this, now you can see this where forceps is going. This is the inside, because it is placed quite deep, light is not going, okay, though I am trying to shift. This is the coronary sinus here, coronary sinus, and this is just above the tricuspid orifice, that is the orifice of the atrioventricular wall, okay, and here it is between the opening of the inferior vena cava. Okay, so this opening is the here, this is of inferior vena caval opening, and here it is the opening of the coronary sinus. So I have shown you the opening of superior vena cava in the right atrium, opening of the inferior vena cava, the coronary sinus, and the right atrioventricular orifice. Okay, now the most of the smooth part, okay, in the middle is formed by the interatrial septum. Okay, interatrial septum means between the right atrium and that of the left atrium. The septum formed between the right and that of the left atrium. So this is the septum, and this is showing the defect. Okay, this septum, you can see this septum. Yes, you can see this. My finger is seen through an opening. Okay, now this is the septum primum. Okay, this septum is septum primum, and this is the septum secundum with the lower free crescentric margin here. Okay, it is placed towards the right atrium, and the septum secundum is more towards the left atrium. Okay, so here the septum primum and secundum, they are enclosing a large space. Okay, large space. Otherwise, in an adult heart, there should be the fossa ovalis. This is the fossa ovalis on septum primum. This is the septum primum, and this is crescentric sep the margin of the septum secundum. That should form the limbus fossa ovalis or annulus fossa ovalis, and this should form. But instead of that, the two septa, primum and secundum, they are still persisting. Okay, but there is a large gap. That is another defect. Otherwise, there should not be gap. They should act as a flap. Okay, so this will prevent the blood flow from that of the left to the right, okay, left to the right. It may go from right to the left, okay, as it is going here right now. This finger, my thumb is going from the left, right atrium towards the left atrium. But here the finger, I can push my finger from the left towards the right also, so that there must have been a free flow of the blood between right and, because it is here that the septum primum and septum secundum, they have not fused with each other, and still a large gap is there. So this is the opening is seen between the two valves, okay, flap like structure, septum, that is secundum, and primum. So this is a big abnormality, and now we could understand that why this heart is abnormal, because of this interatrial septal defect, okay, because of this interatrial septal defect. So you can, once again I will show you. Now the light is there and I can show you, just a minute, let me put it here like this. Okay, now you can see very well. This is the septum primum, which is from the left side. This is septum secundum, which is overlapping to that of the part of the septum primum. Okay, and these two septum, they are enclosing a fossa. I'm saying not fossa, gap. A gap is there, so that the blood from right to left and left to right atrium chamber can easily go. Okay. In the normal condition, this should have formed the fossa ovalis in an adult, and this margin should have formed the limbus fossa ovalis, or that of the annulus fossa ovalis, right? So you have seen here the atrioventricular orifice also from top. I am showing you the opening of the atrioventricular orifice from that of the top, with the three cusps are here. Now this completes the interior chamber of the right atrium. Now I will move to that of the right ventricle, chamber of the right ventricle. You can see in a normal heart, this part is the sternocostal surface, and this is the area for the right ventricle, which if you trace upwards become continuous with that of the, this is the pulmonary trunk, which will divide into right and the left pulmonary arteries. So the sternocostal surface is formed by the right ventricle, then it is the inferior border is also formed by the right ventricle, and if you go to the inferior surface, this part of the inferior surface or diaphragmatic surface is also formed by the right ventricle. So on its right, it is the right atrial chamber, which lies above and posterior to it, and then below this right atrium, this on left side and posterior to it lies the left ventricle. So this is left. This is the atrioventricular groove. And what I did here to expose the ventricular chamber without disturbing the many of the internal structure, I gave a cut near the inferior border, okay, of the right ventricle, and then have gone just at the anterior interventricular sulcus, close to anterior interventricular sulcus, right up to that of the I'm to say, just a minute, okay, just a third block, pulmonary trunk, okay, I'm old man now. It is the pulmonary trunk, okay, and I have given a split into the pulmonary trunk so as to expose the tricuspid pulmonary wall also, okay, pulmonary wall also. So this was the plane in which I have dissected the cavity of the right ventricle. Okay, so let us see the cavity of the right ventricle. Right ventricle receives the blood from that of the right atrium through the atrioventricular orifice. Okay, so putting it into the anatomical position, this gets the blood from the atrioventricular orifice, okay, and then the blood come here, goes towards the apex. See this, my finger, it is coming from the atrioventricular orifice, and then the blood goes here, and then the blood ascend and then goes upward, okay, into the pulmonary trunk, okay. It goes into the pulmonary trunk, right. So this is the chamber of the right ventricle. Again, it has a smooth part like that of the left, right atrium. It has a smooth part and it has a rough part, okay. Now that means it has an inflowing part. That means the blood comes through the atrioventricular orifice from right atrium where my fingers are pointing. It goes in this direction and then it again ascend up and then goes anteriorly into the pulmon. So this is called as the inflow, okay, inflow, and then it will be the outflow, okay. So inflow part and then the out. So outflow part, which through which the blood goes to the pulmonary trunk, is smooth, okay, and this part which is smooth here, this part which is smooth is called as the infundibulum. This part is called as the infundibulum part, okay. Now the rough part, okay, inflow part of this will show you the many. I have just removed this wall, okay, this wall here, but still I can show you the various muscles, okay, roughening of the muscles. And this roughening of the muscle, you can see that they form the muscular ridges, trabecules, okay. Muscular ridges are the trabeculae. These are called as trabeculae carnae, okay. These are named as trabeculae carnae. Some of this muscular ridge may form the bridges also. That means they have the two ends are attached and in between it is free. And the third type of this trabeculae carnae are the muscular ridges, okay, or bridges. The third type is that of the free papillary muscle. See this papillary muscle, this is taking origin from the anterior wall. See this was the anterior wall of the, and this is taking origin from the anterior wall. And then this papillary is the anterior papillary muscles, and then there are the thread like process which are taking coming out from the apex of this, okay. There is another posterior papillary muscle also. See this posterior, sometimes called as inferior also. See this is the posterior, and there will be septal, okay. So you can see here a small septal here. See this papillary and this thread like structure, they are going and getting attachment to that of the the flaps of the cusp, okay, the cusp, okay, they are attached to the cusp, okay. These are called as the chorda tendineae. They are called as the chorda tendineae. Now this chorda tendineae, they are attached onto the ventricular surface and to the margin of the cusp. See this, I will pass a finger. This is the anterior cusp, and if you see this chorda tendineae, thread-like structure, they are attached onto the ventricular, not onto the auricular surface, arterial surface. Okay. So this is the atrium was. This is quite smooth, okay. So it is not, because the blood is flowing through this surface and will go to the ventricular chamber. So it should be smooth. It should be smooth, okay. Now this papillary muscle and chorda tendineae, they are attached not only onto the ventricular surface of the cusp here, to the anterior cusp, to that of the posterior cusp here. See, this is the posterior cusp is here, and there is a small here, septal cusp is also here. But they are also attached to the margin, okay. So whenever they will contract, they will pull the margin and that of the ventricular surface downward, and so this margin of the three cusp will come close to each other and will close the ventricular chamber, okay, when systole will take place. Blood will not regurgitate into that of the atrium. So this is the rough part. One more thing in the rough part, I wanted to show you that this is the anterior papillary muscle. And if you will see here, this is the septum which is convex. See on the bottom here. This area is the septum, okay, interventricular septum, as seen from the ventricular cavity on right side, or the right ventricular cavity. And then you can see a moderator band. This is called as the moderator band. Moderator band means there is a bridge-like cornea or trabecule which is going from the septum, okay, interventricular septum, taking origin, see, very thick here, okay, because this heart is very big, abnormal heart. So this is that margin, septomarginal trabecule. It is called as septomarginal trabecule or the moderator band, okay, and this is going from septum right up to the base of the anterior papillary muscle. Now it is better seen, okay. So this is the moderator band and this is the base of the papillary muscle where it is going. Now this moderator band, since it is extending from the ventricular wall, I mean to say interventricular septum to that of the anterior wall of the right ventricular cavity, okay, this prevents the over distension of the ventricle during the filling of the blood. Over distension is prevented. And another view is that this septomarginal trabecule or this moderator band carries the right bundle of his, okay, which is conducting system to the base of the anterior papillary muscle, so that the impulses, they come first into the papillary muscles and then they pull the cusp downwards, okay, before beginning of the systole, before the whole of the ventricular wall start contracting. Already the flaps or the cusp of this tricuspid valves of the atrioventricular, right atrioventricular, they are already taut, okay, they are already taut. So this is about moderator band, anterior and posterior papillary muscle and septal muscle in the rough area which we have seen here. Let us go to the smooth area of the right ventricle. And if you will see the smooth area of the right ventricle, you will see that now there is no trabecule cornea or septal, I mean to say these ridges of the muscles are seen. It is all smooth and it is the outflow tract. That means the blood will go to the pulmonary trunk, from where it will go to the right and the left lung for purification, because whatsoever blood is received in this chamber the right ventricle is impure blood. I mean to say deoxygenated venous blood, okay. The venous blood is there, okay. Now this is the smooth area, infundibulum of the right ventriculum, infundibular part of the right ventricular. And in this infundibular part of the right ventricular, if you can see from inside, okay, this is the semilunar valves, okay, semilunar pulmonary walls. Why it is semilunar? Because their shape is crescentric, semilune in shape. They are three, tricuspid wall, and they are the pulmonary wall because they are at the base of the pulmonary trunk, right? And here it is the cusp of the atrioventricular wall you are seeing. See this? Two. Here is the pulmonary valve and here is the right atrioventricular. In between the two, can you see this where light is falling? This where I am moving my tip of the finger, okay? This is a ridge of the muscle. See, very strong ridge because it is a large heart. A strong ridge is here, and this strong ridge is called as, what is strong ridge? It is called as, okay, between these two, okay? This strong ridge lies between the two, okay, between the, I mean to say, opening of the pulmonary trunk as well as the opening of the atrioventricular ball. This is called a supraventricular crest. See, this is crest-like structure, very thick here in this case. This supra, and it is the demarking point between the smooth and the behind it lies the rough part and above it lies the smooth part. So this is supraventricular crest, it is there, okay, supraventricular crest. Once you have understood the supraventricular crest which lies between the two openings, atrioventricular and the pulmonary valves, then I will open this valves, okay, or pulmonary trunk. I have given a longitudinal split here so as to show you these valves, okay, semilunar valves. So I have opened these valves here. See this? Splitted and open it, and then you can see the presence of this semilunar wall. I will just put my finger if it is not clear to you. There are three. The one is here, second is here, and third is here. I will put this finger in this semilunar wall, tip of the finger. Yes, I have put my tip of the finger in semilunar wall, and blood fills during the closure, okay, when the diastole is taking place, the blood, these walls are closed, okay, and this is because of the filling of the blood in these pockets. See this? Such a big pockets are there. There will be third here, and here I can also put my tip of the finger. Oh, it's not going anyway. Just a minute, let me open it. Yes, this is the third wall, okay. So these are the three semilunar wall. The middle part of this wall is called as the nodule, which is the uppermost point of this, and then the margins are called as the lunule, okay. They are called as lunule. That you can get it into the theory, okay, book. And this nodule is nothing but a hard point, okay. And these three nodules, they come close to each other during the closure, and when the closure takes place, these three walls, they will come close to each other, and they will not allow the blood to pass back from pulmonary trunk back into the cavity of the right atrium. So this is the semilunar valves, okay, semilunar pulmonary wall. Now these valves, they are having the names, okay. In the anteroposterior, if you will keep the heart into the anatomical position, there is one anterior, okay, and this one is anterior, and then there will lie one right and one left. This is, okay, let me show you. This is the left, towards the left ventricle. This is the right, towards the right atrium. So it is the right wall, this is the left cusp, and this is the anterior. So these are the three cusp of these, okay. I hope that I have covered almost all the parts of the left ventricular cavity, except that if you will see the thickness of the wall of the left ventricle here, as you can see here when I am filling it between the thumb and the finger, this is thin as compared to that of the thickness of the wall of the left ventricle. See this thickness here, okay, let me show you. See how thick is the wall here. See this? So it is quite thick wall is present onto the left ventricle here. See this? As compared to that of the right ventricular cavity, okay. This completes the cavities or the chambers, okay, of the chambers of the right atrium, rough and smooth part, and there was a defect was seen, interatrial septal defect was seen in this case, and then I have shown you the cavity of the left ventricle. This is the inferior border, okay. So this is the sternocostal anterior wall, okay, and you can see that the blood flows in this direction parallel to the inferior border of the coming from right to the left, and then again ascend upward, okay. So inflow part and then the outflow. You have seen the papillary muscle, moderator band, septomarginal trabeculae, and then supraventricular crest, okay. So you have seen almost all the structure. Thank you very much for watching this video. Though the light was, I could not focus the light with the help of any other additional torch or something, but I think major thing you have seen. Now I will, in the next video, I will complete the cavity of the right atrium and the cavity of the cavity of the left atrium and cavity of the left ventricles, okay, and the two valves. I will show you the cusp of this wall. Thank you very much for watching this video.